Do you know that around 40% of dementia is preventable, or at least can be delayed by changing certain lifestyle habits? So we now know that there are 12 non-modifiable risk factors associated with greater risk of dementia. This was published recently in Lancet. Hello and welcome. Today I am going to discuss about brain health. Can we prevent dementia? What is the importance of brain health for young people? Do you know that around 40% of dementia is preventable, or at least can be delayed by changing certain lifestyle habits? So we now know that there are 12 non-modifiable risk factors associated with greater risk of dementia. This was published recently in Lancet, and we are going to focus on some of these factors. If we focus on these factors early on in our life, it can help in preventing dementia. So as I said, around 40% of dementia is preventable. So let us explore these factors. Number 1, good nutrition. Brain is only 2% of our body weight, but it consumes around 20% of our daily energy supply. That says good nutrition is important for brain health. So for healthy brain, we need to include whole grains, vegetables, fruits, especially berries, nuts, beans, oily fish, and limit sugar and fat. A good diet helps us to maintain a healthy weight and lowers risk of diabetes and hypertension. These are associated with increased occurrence of dementia. The second point is hydration. We are made up of around 60% water. Hence, it is obvious that staying well hydrated is important for our brain function and overall health. Brain functions, specifically memory, attention, concentration, and reaction time, are all affected by hydration status. So good hydration is important for optimum performance. So number 3, reduce alcohol consumption. According to World Health Organization, no level of alcohol consumption is safe for our health. There are some limits and recommendations by different organizations and countrywide, but overall, there is no level of alcohol consumption is safe for our health. And research shows drinking too much alcohol can increase dementia risk. So there is a direct relationship between intake of alcohol and dementia risk. The fourth point is we need to be active. So exercise has many benefits for the brain. It increases blood flow to the brain and is beneficial for several functions and increase brain activity and volume, making it more efficient. So we should aim for at least 150 minutes of moderate intensity physical activity per week, or at least 75 minutes of high intensity exercise per week, or a combination of both. The more we move, the better it is. But even if we can achieve like 10,000 steps or low intensity activity or whatever it is, keep active. That improves brain volume and that decreases the dementia risk. The fifth point is about socialization. Research shows social isolation and loneliness associated with higher risk of depression and cognitive decline. So it's very important to have good connections with friends, families, and also in the social circles to strengthen our brain's networks. The last important factor I would like to mention today is about learning. Keep learning. Continue to learn. Learning has a protective effect on the brain, and research shows people who continue learning throughout their life had a 7% lower risk of dementia. So we can learn some new activities, new skills, new language, new sport, a musical instrument, or doing puzzles or anything. A new learning is always good for cognitive health. There are also other factors such as good sleep, managing stress, and several others. So the brain is perhaps the most important organ we have. So by taking care of it while you are young, you will ensure it continues to perform well as you age. So hope this video is useful. Please like, share and subscribe. Thanks for watching. Goodbye.